All right, well, we should be live here now in theory for Facebook Live. This is the inaugural event, so we're going to wait a couple of minutes to see if we can get some people on to watch tonight, and we should start in just a couple of minutes. A big shout out to Jolie Rusnak, who's actually running camera and lights for me tonight. She waved, you didn't see her, but she waved. And everybody else got to go get ice cream. And we're coming at you live from my own home tonight. So just kind of deal with the surroundings for a little bit, and then we'll just enjoy what I'm going to talk about tonight, and we'll see how things go. Hello, two people.
Connie.
Hi, Connie. Hey, make sure that if you're on there, you send a little comment or a like or something like that down at the bottom. It's just so we can get some interaction. And if you have any feedback or things for me, that would be great. And I'm sure Jolie will give me some feedback as we go along here. All right, we'll wait one more minute and then we'll get started. And this might be the way that we start communicating with our folks as well, because due to the coronavirus and things like that happening, we may be doing a lot more telehealth, where you can Skype in to talk to us if you need questions answered about physical therapy or what you're doing for your rehab program. So there may be maybe a near future here where we do this a lot more often. All right, so I'm going to go ahead and get started, and obviously people can chime in at any time. Tonight, this is actually an inaugural event for Cutting Edge Physical Therapy. We've never done this before. I was challenged by a group with Richmond Social Media. You folks know who you are. So they said to do this within the first 24 hours of trying to learn how to do this, and here we go. So this is the first attempt. I'm going to talk about two different things tonight. I'm going to try to keep this to about 10 minutes max. And then I'll give you a little teaser at the end, something that you might not know about physical therapy. So today we're going to talk about the top 5 reasons why you might need to seek out a physical therapist's help. So the first thing that we want to talk about is improved mobility. So a lot of people come in and they have a problem with a joint or a muscle, they're feeling tight, there's restriction in how they move. We see that all the time. So whether or not you've had tendonitis in the past and your shoulder joint doesn't move the correct way anymore, people seek out physical therapists for that. And in addition to, anytime you have pain, that is not normal. So there's no such thing as pain as normal. So if you're having pain, and if you actually had pain for more than 3 months, you should actually seek professional help, whether or not you come see a physical therapist or another healthcare practitioner. So the second reason that people should seek out physical therapy is pain management. And that's essentially to decrease opioid use. Okay? So obviously opioids have been a big problem. They're obviously not the center of attention right as we speak, but the opioid problem has been obviously a main issue in the last 10 years. So if you have taken opioids for more than a short-term issue, you should probably seek physical therapy, because we're going to be able to give you strategies and other options that don't have to use these really mind-altering drugs and body-altering drugs for long periods of time. And obviously, use of medication in general is really not healthy for your body. So just as a couple of side notes, 25% of the entire population has low back pain on a regular basis. We treat that all the time in the clinic. In addition, 10% of people have chronic neck pain. We treat that all the time. Chronic neck pain and actually headaches. The third thing that I would tell you is the vast majority of other people are rotator cuff related problems. And we see that all the time. Whether or not you were cutting firewood, throwing firewood, doing something outside, mowing, trimming, weed eating, any of those kind of things can cause you to have rotator cuff pain. The third reason that people should seek out physical therapist help is really to maybe try to avoid surgery. And obviously, if you've had surgery, we do that all the time, and we rehabilitate people all the time, and that's something that people know pretty much hands down that physical therapists do that. But a lot of our surgeons that we work with on a regular basis send people to us because they really want to try to avoid any type of surgery at all. A really good surgeon, which we have many in this area, will do surgery at the last resort, and we're often the first people to see you prior to that, because oftentimes we have people come in and they don't need surgery. We can get them better with movement or movement therapies or some manual therapy or anything like that. So avoid surgery. And the biggest thing for that is, in the scope of healthcare, physical therapists are really cheap compared to having a $50,000 back surgery. So there's a significant health savings there for you. The fourth reason that we actually do this is recover from an injury. Whether or not it's a workers' comp related injury, a car accident, slip and fall at your house, we do that all the time as well. Obviously, people have fractures, some people have surgery, even people don't realize this, but we treat concussions, those type of injuries, people who have headaches related to that, or balance or dizziness related issues. So we try to help people recover from surgery and other related injuries. The fifth reason that maybe you or a loved one should seek out a physical therapist is fall prevention. In the last couple of years, Medicare has come out with some statistics that states it costs Medicare over $50 billion because of falls in the last year. That's an incredible amount of money that could be used other places. So a lot of fall prevention and education is something that we do on a regular basis. And it's really can be for anyone. But as you notice, if you're not 25 anymore, your balance is probably not the same as it used to be. At 55, 60, 65, and 70, that balance tends to go down over time, and we can really actually help that with a lot of people. So if you have a friend or a colleague or a loved one who's actually falling, that's going to cost us a bunch of different that's going to cost a bunch of money. And the last thing you need is your loved one to fall at home, because when Jolie falls, she bounces back up. When I fall, I tear my rotator cuff, and when someone who's 70 falls, they break their hip or their arm. And that's just a tremendous amount of loss of function and a long haul of rehabilitation. So these are really some 5 points of why people might seek out a physical therapist. Certainly there are other things, and we can do that in other videos if anybody has an interest in seeing some of that. I want to also talk about the top 5 diagnoses that we see on a regular basis. We're just going to go right down here. And the first thing that we see on a regular basis is low back pain. Low back pain is something that we treat every single day in the clinic. And our biggest thing is, I don't fix anybody. I tell you and I educate you on how to fix yourself. Because the body's a pretty amazing thing. If we do the right things and put you in the right position, the body gets better. And it gets better very quickly often. So low back pain, and again, it goes back to that 25%. So 1 in 4 people suffer from low back pain. The next thing that we treat on a regular basis is neck pain and headaches. Most people don't realize that most headaches, not all, but a vast majority of headaches come from the neck and right back behind your noggin, and we fix a lot of those people. So if you're having headaches and you've had chronic headaches for a long time, that's not normal. Make sure that you come in and see a physical therapist for it. The next thing that we often see is knee pain. And also osteoarthritic knee pains or problem with meniscus tears. What most people don't know is that if you've been diagnosed with arthritis, your best bet is to come see us first, because oftentimes there are exercises that help get that better. You obviously don't change arthritis, but you'd be surprised at how much people's pain goes down and function goes up. And also people who've had meniscus tears. If you're thinking, I'm going to go get a scope for my meniscus tear, on arthroscopy, which is a surgery, they're trying to get back from that a little bit, because they're showing that the outcomes aren't just that great. If you're younger, they're pretty good. The farther you age, the more you age, the less likely that surgery has actually helped to improve you. And we actually see people coming in who have meniscus tear, have a scope, 6 months later need a knee replacement. So that's what we treat that on a regular basis. Number 4 is obviously rotator cuff problems or rotator cuff tears. We see that a lot in the clinic as well. Obviously, general wear and tear on the rotator cuff happens all the time. So we see that often, and we can help people with that all the time. So that's a real issue. Or shoulder pain, just in general. If you've been diagnosed with impingement or tendonitis or inflammation of any time. And then probably the 5th thing that we see, and by the way, this is probably 50 to 60% of our caseload on an any-day basis. The last thing is we do fall prevention or balance-related treatment, and that can come from I'm just falling, I have diabetic neuropathy, I have dizziness, vertigo, any of those type of things. Concussion can roll into that category as well. So these are the 5 things that we typically treat, but just from a mention standpoint, we treat TMJ pain, we treat hip pain, sciatic pain. Sciatic, remember, is not a diagnosis, it's a symptom of another related reason. Foot pain, plantar fasciitis, wrist tendonitis, wrist sprains, tennis elbow. We treat all of those kind of things. And each one has a very specific treatment technique that usually goes along with them. So if you're having any one of those problems and if you've had it for more than 3 months, you've got to get in to see us. The earlier you see us, the better it is. So if it's over 90 days, you got to come in and see us. Now, the last thing I'm going to end on and kind of wrap all of this up for our first video today is really to let you know that I would tell you that a vast majority of people don't know that you can come and see us directly. You don't need physician referral. You haven't needed physician referral since 2013, all right? So you don't need physician referral. You can walk in the office and make an appointment. You can call the office and make an appointment. And yes, by the way, we are actually open. We're considered a vital part of the medical team right now because we have people who are still recovering from surgery. So we are treating patients right now. We are using extra precautions in the clinic that are above and beyond what we normally do. This really doesn't change for most healthcare providers because we take care of all of our equipment and all of our patient needs and try to keep you all safe. So we are open. If something would change, I'd come on live and let you all know. Now, the other thing that you might, if at any time you have questions, you can contact me via Facebook, but you can also use my phone number, which is my office phone number, which is 939-4871. So I'll put that up right here, 939-4871, and you just ask for me if you have a question. The other thing is my email, and my email's kind of long, but I'm going to write it down here, and Jolie can she can kind of zoom in on it for anybody who wants to know, and this is my clinic email, so you can get me at any time. Feel free to use that. I have access to my email. It's jason.rusnak@usphclinic.com. You can contact me anytime. I'd be happy to help. If you just have a question, sometime down the road, I think we'll probably do Ask a Physical Therapist. It'll just be live like this, and we'll just do questions. I'd be happy to do that anytime. So, and for our next video, I just want to give you a little teaser. Our next video is going to be the top 10 misconceptions about physical therapy. So we'll probably do that next week sometime. After I get some feedback from this video, you don't want to miss this, top 10 misconceptions about physical therapy. And I think we'll probably end the video there, and certainly I'd love your comments and your feedback. As I said, we're doing this for the first time. Whether or not the lighting was good, I couldn't read your writing, I didn't like your tie, whatever it happens to be, but just go ahead and give me some feedback, and we'll probably sign off now. So thanks for coming, and if you have any questions, give me a call and contact. Have a good night, and be safe.